Kia ora, everyone. This is a webinar, pre-recorded webinar, where we're having a bit of a discussion with the panel, looking at various aspects and perspectives around what is needed in the design of a future-proofed medicines policy for New Zealand and a strategy as well. I'm lucky to be joined today by Todd Krieble, who's the Deputy CEO at the New Zealand Institute for Economic Research, NZIER, and the author of a discussion paper, which is up on the website, the details of which will be at the end of this webinar. Todd has also worked in very high-level strategic positions within the Ministry of Health most recently, so does have some views and expertise in the health sector. Also lucky to be joined by Dr. Chris Jackson, who's a Medical Director of the Cancer Society of New Zealand, advisor, I believe, an independent advisor to the Ministry of Health's Cancer Control Agency, and obviously as a well-known medical oncologist practicing at Dunedin Hospital, as well as in between all of that, a senior lecturer in medicine at Otago Medical School as well. We're also joined by Liz Naylor, who's the chair of the Medicines New Zealand Policy Solutions Working Group, and the group manager of Janssen, which is a division of Johnson & Johnson, so she's a group manager of Janssen New Zealand as well. And our international guest today is Brendan Shaw, who's the founder of Shoreview Consulting, which is based in both London and Sydney. He's been an Assistant Director General of the International Federation of Pharmaceutical Manufacturers Associations. He's an economist by training and has worked in the government and consulting capacities in academia as well, and as well as an advisor from a policy advisory perspective of the Australian federal government. So welcome to you all. I'll kick off, if I may, with the first question to Todd, which is, what do you see the case being for a New Zealand medicines policy in New Zealand?
Thanks, Graham. Well, it feels like it's time for a refresh. The current strategy goes back to 2007, which is pretty old in terms of policy terms. It did have a couple of plans associated with it, and the latest plan, that's 2015 to 2020, is basically running out this year. There's a lot happening, I would say, on the equity and access front generally. That means it's probably time for a refresh. There's new technologies. There's some new things coming online that are, kind of high benefit, but can sometimes have high costs. So you really need to think about how you evaluate those. And I think of special importance is the fact that there's a health and disability services review that has excluded some aspects of medicines, and they're obviously very integral to the whole running of the health system. So yeah, the time just feels right for that.
Chris, what's your perspective on the case being for an update or a refresh of the medicines policy within New Zealand?
Yeah, well, certainly I could speak from the point of view of cancer, I guess, and people affected by cancer. And from the end user perspective, the issue has been that New Zealand's dropping down the ranking lists of access to medicines internationally. And then I think we kind of have a de facto medicines policy, which is what Pharmac says it is. And the issue with that is that Pharmac being independent from government is perhaps a good thing, but that political distance between Pharmac and government means that government's not really steering with priorities around what they see as important and what's not. And that does limit the public policy debate around medicines, which I think is problematic. And so I do think we need to have some steering principles behind that, some overarching political governance and direction for the ways in which the politicians, who are the people who our community elects, in terms of what the community wants in terms of access to medicines and what the levers are there. Otherwise, you'll get this autonomous agency without recourse to a minister necessarily. We know that that's what has happened over successive governments, as ministers have said, that's Pharmac's business, I'm leaving it to them. So we do need to have that connection between our leadership, our political leadership, and the implementation of the policy framework. So that's why I think we need that public policy, because without it, you get an agency who ends up without accountability, which is not good, good public practice.
Thank you. And Liz, your perspectives?
Look, I couldn't agree more with both Todd and Chris's comments there. The reality is that the existing strategy actually expires this year for medicines policy. It hasn't been utilised or referred to, as Chris has alluded to. In fact, it has been being set by Pharmac, but good policy evolves as well and is future focused. And our current system for medicines access has not evolved, and one can argue that it's not particularly future focused either. Policy needs to, of course, traverse also public opinion, and it's also important to have close collaboration with all stakeholders. So the voice of the patient, government, health experts, and also industry. And that's what I hope that we're beginning to have that discussion now, is that closer collaboration with all stakeholders.
Thank you very much. Yes, the next question is mainly to Todd and Chris, because you've obviously worked in association or with the New Zealand government, and there are certainly plenty of strategies and plans around health and other areas as well. I mean, but specifically around health plans and strategies, I mean, are they really effective, and do they really make a difference? I'll fire that one if I can to Chris as a starter. Do these strategies and plans, do they show effectiveness, and are they really making a difference, in your opinion?
Well, I think the issue with medicines in particular is that medicines has largely been excluded. So it was specifically excluded from the National Cancer Plan, and it was specifically excluded from the Whole of Health Systems Review. Now, I think that PharmAC as a model has broad public support and broad political support, and I think they've done a very good job of ensuring that the bill to taxpayers is pretty limited. So that has been a real success of the model, and I think the model has a lot of strengths. But I think the reviews that have happened of PharmAC have largely been of PharmAC by PharmAC, and asking yourself if you've done a good job is not a particularly effective way of ensuring that your strategies are robust. And so I do think that's why it's timely to ensure that you do review and tweak, and that you keep the good stuff. And certainly medicines are not the same now as they were 10 or 15 years ago, which is why it's important to make sure it's updated and remains fit for purpose. I think that if a review were held and you did get a new strategy or policy, that a lot of the fundamentals would remain the same. Absolutely, I think that would have a lot of political and governmental support for that, and indeed community and sector support. But I would hope that there could be some improvements in the way in which our system runs that could deliver an even better system for New Zealanders. So it's a long-winded way of answering the question, do policies and strategies matter? I think absolutely and utterly they do. Do they have an impact? I think absolutely and utterly they do. Do we have one at the moment? Not really. It's kind of been left off the table. But if we had one, would it be radically different? Probably not radically different. But I even think that minor changes, incremental changes, would be helpful and beneficial. And at least having the opportunity to let people have their voices heard and have a say over what gets done.
Thanks, Chris. Todd, your perspectives there.
Yeah, look, I think that was great. So I agree with everything Chris just had to say. And I think what I'd add to that is that there's a lot of strategies around, and a lot of them just end up sitting on shelves. And for them to be really effective, I sort of look to the sort of 5 key things around collective impact. So it's making sure, and I think the opportunity is for this strategy, if we work it through with stakeholders, you've got, we can set it's a common agenda. If we can get some shared measurement into that, if we can think about how we provide each other with some multiple mutually reinforcing activities, and there's lots of good communication, and we've got some backbone support to kind of actually make the strategy real and not just be something that sits on a shelf. And I think those are the kind of strategies in a general sense that can be successful. So I see every opportunity here for this. I mean, a lot of the stuff that we put in the discussion document has come out of the OECD report that was commissioned by OECD health ministers. And a real key strong theme in there around making strategies and being effective is to make sure that you've got good stakeholder engagement and that you're working collectively. So I just really think that's probably the critical issue, I would say, when I see strategies that work and strategies that just, sit on a shelf.
Yeah, Todd, I think that's some really good points you've just raised as well. And I think linking the strategy to your actions is the key thing, isn't it? Because otherwise the strategy does just sit and gather dust, or it has to actually be linked to the way things are delivered in our system. And in New Zealand, that would come down to funding priorities, it would come down to funding mechanisms, it would come down to processes for reviews, absolute amounts of money that were allocated to the system, that type of thing. And if you had that in a strategy that was linked clearly to implementation, then you would genuinely get that link between a strategy and an outcome, which is, the purpose of a strategy, isn't it, is to change things and to deliver outcomes.
That's it.
Really good points. Thanks both of you. I mean, Todd, specifically, can you tell us a little bit about how you went about constructing this particular consultation paper that you put together? I mean, why it includes what it does, and is this a new way of designing policy?
Yeah, so at one level, I think we've used just traditional kind of policy approaches by setting up a problem definition. So again, I think we're saying there's some real equity and access issues that we see coming potentially adrift here. Just setting up what you'd call in policy or economics an objective function, which is really, the health system relies on that triple aim. So we're talking about, looking at value, equity, and effectiveness in a policy that would apply across health systems, not just in medicines. And then Chris kind of alluded to as well, to make things happen, you just draw on the WHO framework of how you design health systems around leadership, funding, delivery, information, and workforce. So we got a bit of a structure there. So we just gone through really with those, the triple aim, and looked in each of those 5-6 areas, what we might do differently. And in doing so, we just really were looking to identify good. It's good to look at best practice, but a lot of times it's just looking at good practice around the world. So we tried to bring that to bear to see where we might have been out of alignment. Again, drawing on that extensive work by the OECD that was produced for health ministers, because again, we're, as a member of the OECD, just wanting to be in sync there. Those are a lot of the countries that we do tend to compare ourselves with. And I think the other thing that's really interesting here now also is that it's really important to have more, and there are tools now that allow us to have wider public participation in design of policies. And I think this is a great opportunity, Graham, that you've taken to trying to involve a wider stakeholder community and wider dialogue, so that when it is time to talk to government, you've got a bit more, things are a bit more considered.
Oh, that's great. Thank you for that. We're going to change it up a little bit, and we'll bring in Brendan from Australia. Brendan, this is a question which we'll start with you, which is, what are some of the game-changing innovations in terms of science and treatments and other opportunities that you're seeing coming through in this space at the moment, the health space and the medicine space too?
Yeah, look, it's a fascinating time actually to be involved in medical technology. There's some of the science that's coming through now. So things like sequencing the genome that started 20 years ago at the turn of the century, that's now finally starting to bear fruit. You're seeing more and more therapies come through that use this genetic level. So, for example, last year, the US FDA approved about 48 medicines, of which 42% were considered novel therapies, as in first in class, and 27% were designated as breakthrough. And about a quarter of all the medicines the FDA now approves roughly are biologics. And that's a trend you've seen over the last few years. So there's lots of opportunities coming out of that. I mentioned the cell and gene therapy areas. It's changing the nature of medicine more and more. It's targeting treatments to particular patients, which is obviously changing patient outcomes, but it's also changing the economics of healthcare and changing the business models and how the industry works. So you're also seeing medicine and device combinations. You're seeing digital technologies interacting with medicines, treating in areas like cancer, rare diseases, even some infectious diseases. So I think the exciting opportunities are that there's a wave of new therapies coming through the industry, and it's getting more medicines approved now than it ever has each year. I think the challenges for countries like Australia and New Zealand are that these wave of new therapies coming through, which is a great thing. We're getting all these new opportunities and new treatments for diseases we couldn't treat before in many cases. The challenge for governments and payers is how they handle that as these therapies become available. And so how do we deal with that? And that's also linked with digital technologies as well. So big data, artificial intelligence. I mean, we're now seeing clinical trials where computers are starting to identify and design drugs, literally. So all of that's providing a lot of opportunities, but I suspect also for payers and health systems, there's a lot of new issues and challenges to deal with going forward.
Now, I'll put that question now to Liz Naylor, if I can, which is, what are you seeing in terms of the game-changing innovations? You obviously represent the industry perspective as well, working obviously with Vincent. So, I mean, are you excited? As excited as Brendan about what's coming through?
Absolutely, Graham. Look, the the degree of innovation in medicine and vaccines is phenomenal. And I mean, we see the innovation across many industry, and especially, you know, coming along very, very fast with increase in technology. But diseases with high unmet need are problematic in that they inflict great personal and also societal burden. These diseases are a real focus of R&D to try and significantly improve health state in some of these diseases. And some of these targeted therapies that Brendan refers to are now actually even achieving cures. We've seen that in hepatitis C. We're beginning to see there's some very promising work in hepatitis B in those infectious disease areas. The exciting space of R&D is without a doubt cell and gene therapy, CAR T therapy. It's taking that concept of gene manipulation and bringing it into reality, just even in the last couple of years. These targeted therapies are treating diseases that have devastating and prolonged impact, and in some cases, premature early death. The targeted therapies include advances in solid tumour cancers, hematological cancers, Crohn's disease, diabetes, rheumatoid arthritis, bladder issues, multiple sclerosis, even structural complications such as the invertebral disc degeneration. And a biggie that there is a lot of clinical trials behind is Alzheimer's. So, I mean, the ultimate goal of our R&D efforts is really this concept of disease interception. So it's being able to understand that disease intimately, predicting and preventing the disease from even taking hold. What we see, and this is exactly what we see rather in vaccine development, and most notably now with the collaborative efforts to find a COVID-19 vaccine, but also recently with HIV vaccine, Ebola and SARS has been really well demonstrated. I think it's important to also say these advances are great, but we need to be able to get them in the hands of the people that need them. And there's been just as much advances and collaborative efforts around global solutions to ensure equitable access, that those of us in OECD wealthy countries are able to support a system that enables individuals in countries like Africa and others to be able to access these innovations as well.
Chris, maybe over to you. I mean, what are you seeing from a clinician's perspective, a specialist perspective? Are you excited? Are you seeing some opportunities coming through? I mean, in the oncology space, I suppose you can speak about.
Yeah, certainly I think the pace of change is like we've never seen before, really. I guess we've had the era of immuno-oncology probably for the last 5 or 6 years or so, and that's become a very busy space all of a sudden. And as a clinician, it's extraordinarily hard to keep on top of the data, actually, because there's just so much happening, and the pace has just been huge, which is great. And also repurposing of old medicines and better combinations and use, even still chemotherapy studies still dominating ESCO on the GI stream even still. So we're still finding new ways of using what we've got to get better and better gains. I mean, it shows to me the value of good research, both publicly funded and industry funded. I think you have to have the balance of cooperative group independent work alongside academic institution and pharmaceutical industry funded research to drive that innovation across the spectrum. And that is delivering real meaningful gains for people. I think there are challenges in the speed of research conduct because it is becoming quite competitive now. And the challenges are ensuring that the balance between getting effective medicines into the hands of the patients early is not going to lead to compromise of scientific design and scientific integrity, because you've got potential for contamination of scientific conduct if you do have an ultra-competitive market, which can actually be problematic. So yeah, extremely exciting, lots of changes happening. That does present structural and research challenges as well. and good times ahead. Certainly good times to be involved in research because you're really making major changes. I think the exciting thing as well, which has been happening, is the treatment toxicity has been getting lower for patients who've got chronic disease as well, and that's exciting, seeing the quality of life of patients improving as well. And you've got a balance between treatment intensification on the one hand and de-intensification on the other, with a focus on both cure and quality going on simultaneously. The advances we've seen at a pace which I didn't dare dream of when I started oncology, and it has accelerated rapidly. I think that presents also a big change for funders and regulators to keep up to date with that and have a pipeline of a regulatory approval process which is appropriate and robust, not just offer a couple of patients in a phase 1 study, but robust data that does actually enable the right drug to get funded at the right time, not too early, and yet still is responsive enough to get things through. I guess we see contrasts in the US where stuff gets through regulatory levels pretty quickly, whereas in the rest of the world might be a little bit slower. I think perhaps the rest of the world might have it slightly better than the FDA in terms of getting that pace right. But then there are other examples like New Zealand, which perhaps it's actually a little bit too slow. So I think we have to get that pace of getting the drugs into the hands of the patients a wee bit better in our own environment.
It sounds almost like getting the policy settings right as well as the strategy. So that's a key part of it. Yeah, thank you, Chris. Speaking of policies, I'll throw this over to Brendan because obviously there's a national medicines policy that Australia's had for a while. Are there themes in terms of what you're seeing happening in Australia with the update of the national medicines policy? So, Brendan, and what are those themes? Can you tell us what's happening there in Australia?
Yeah, sure. So actually, at this point in time, right now, not much is happening. Actually, but that's for entirely understandable reasons. We're in the middle of a pandemic that's the health systems have to deal with. So that's fine. I think that's good. Look, I think there's general agreement across the political spectrum that the time's right to do a review of the national medicines policy. It's just celebrated its 20th anniversary very quietly, and there wasn't a party or anything. And look, certainly I think the policy's been good, but I think it's frankly starting to look a bit long in the tooth, given all the issues we've been talking about already. Many of those are not even flagged or foreseen in Australia's national medicines policy. So there's a lot of issues there to look through, and many new developments in health policy and technology that really, for an up-to-date medicines policy, you would have in it, and Australia has not reviewed it for 20 years. In terms of where we are in terms of the process, there's been some discussions up to the end of last year and earlier this year about starting the review. We've actually been talking about a review for about 3 years at least. Back to 2017, people have been flagging we need to review it. So we've been talking about the review for a number of years, and obviously COVID's influenced the timing of that. Probably most recently, earlier this year, the Australian government laid out a timetable for that review. Roundtables in June, July about now, and then finalising the review in August. And I think the reaction from some people was, and myself included, was that sounded a bit like a much shorter scope, almost a tick and flick exercise, rather than what I think some of us were envisaging, which is a much more comprehensive strategic review. My argument was we only do this once every 20 years, so let's take some time to do it properly and have a comprehensive review and look to the future and have a strategic review. So I think, but that's all obviously been on hold given the COVID outbreak. So one would hope that as we come out the other side of that I think the attention will turn back to the review and get it started. I think one of the interesting things too for the review here going forward will be what the impact of the COVID-19 pandemic has on thinking around the national medicines policy. I think there's been a number of issues that the COVID-19 outbreak's thrown up that I think are quite relevant for talking about long-term health policy and long-term national medicines and technology policy.
Yeah. Brendan, is your hope that, and Chris and others have talked about sort of the excitement around all the innovations that are coming through the pipeline, not just in oncology, but even in chronic disease areas as well. Do you think that will be embedded or considered as a major theme that needs to be reworked in the national medicines policy in Australia?
Look, I think one of the big themes will be to be aware of and anticipate some of the things that we've spoken about already, actually, sort of the new technologies coming through, but also the blurring of the boundaries between medicines and devices and digital technologies, as well as things like, you know, what are patients expecting, and how patients behave and what they want today is vastly different from 20 years ago. You know, we had no internet, or you know, people weren't using Dr. Google 20 years ago, whereas whenever someone gets sick, the first thing they do is go and Google their symptoms and see what it might be. So there's all these sorts of behaviours and changes in society that have happened that we need to incorporate. So I think, yes, I think a lot of the exciting opportunities, but also some of the challenges, I think, you know, the regulatory challenges, funding challenges, and all that, and the sustainability challenges, they're all up for discussion, I think, and should be up for discussion as part of a review of your national medicines policy.
And it sounds like it was 20 years ago, I guess, quite a collaborative process. I mean, you mentioned the term round table, so you had all major stakeholders involved in that, you know, obviously from the federal side, I guess some of the state as well, but also you had industries, you know, medical devices, pharmaceutical as well. So everyone actually sat and engaged in what sounded like quite a collaborative process. Was that part of the success, or part of what you think was a critical success factor for the initial medicines policy in Australia?
Look, I think it was, and I think if you speak to people who were involved in it at the time, that's what they'll say. And one of the things, often with a lot of these stakeholder exercises, it's actually as much the exercise of developing the policy as it is the policy itself.
Yeah.
Because you've got all the different stakeholders who've got a say in it, they've put their inputs, they've been discussing it, and obviously there'll be discussions and disagreements, but at the end of the day, they've got buy-in to it. And I think that's, you know, it's actually as much the process of developing or reviewing that policy as it is about actually whatever the document says. Because by doing that, then you've got all the stakeholders in the process who want to take that forward. And so because they've been had a hand in it, I think that helps build consensus and strategy in a collaborative way that helps the policy continue. And as you were alluding to before, so make sure it actually is used and goes forward.
Very good point. Thank you so much. Right. We've talked a bit about this, and we've touched on this across this webinar so far, but do you think, and this is a question for everyone, we'll start with Todd, do you think there are lessons from the current COVID-19 pandemic that bring the need for a new medicines policy into stark relief in New Zealand, or even Australia, in your case, Brendan? But Todd, what are your views? Do you think there are some real lessons that we can learn from the current COVID-19 pandemic?
Yeah, I think the big one, Graham, is that we've sort of alluded to here. It's about having some of those. It's about having those relationships. I think enduring relationships, they need to be more than transactional, and having a solid collaboration. And if we've got that in place, I think when things get stressed, we're able to call on those relationships. I know we had some issues early on with some of the supply chains and things like that, being the last bus stop on the planet sort of thing. I think it's good to have those relationships. I know we've had issues sometimes with vaccine supply. And I just think if you've got the relationship capital, you can call on it when you need to, rather than, as I say, being a bit too transactional, which I think we've sometimes reduced things to.
Chris, any lessons you think we can learn from this current pandemic, which hopefully we're working our way through?
Well, I think people might argue that a couple of different ways, actually, Graham. I mean, I think that some things that happened during COVID regarding medicines were actually very positive. We saw Pharmac being very responsive very quickly and making some decisions that really took the pressure off the health system quite quickly. And it showed what could be achieved with urgency when you needed to. And I thought Pharmac responded very well early on to those challenges. Now, Pharmac might actually say that, well, look, that demonstrates that no change is needed because we did such a good job. But I think what to me it highlighted was there was an understanding of how actually the health system is interconnected, and what happens in medicine has an impact on the day unit infusion utilisation, has an impact on doctors and nurses resourcing, and how interconnected that is. And it highlighted the need to make sure that we're really aware of the impacts and knock-ons at each step of those systems. And I'd like to see that systematised. And it's certainly something we've brought up on a number of occasions, is the interconnected nature of the healthcare system. So yeah, I mean, that fluidity, that willingness to change, react, respond and support each other, I thought was really positive. I think that reflected very well on the people who were involved, you know, the individuals who were driving that. Particularly, again, I thought the people who we dealt with at Pharmac were very impressive at that time. but also I think it's foolish to make public policy around personality, and you need to make sure that actually those strategies are embedded in a part of the culture rather than just reflecting the excellent work of some good people.
Good answer, well put. Liz, your views, do you think there are any lessons?
Listen, I'm just very briefly, I echo what people said here. I have to admit that it was a great relief to understand the bipartisan and national feeling of valuing life and what we were prepared to do to prevent premature death here in New Zealand and around the globe. So that's one fairly strong message that came through to me personally, and I feel very encouraged by. But also, I echo the nature of needing to be prepared requires really close collaboration, both nationally but also globally with R&D efforts in industry. Close collaboration means being able to quickly form alliances and investment that is agile enough to be able to respond to events that are largely unpredictable.
Brendan, I mean, what's your view? Has Australia learnt some lessons from this COVID-19 pandemic in terms of its medicines policy, perhaps moving forward, some learnings that could be put into the NMP when it starts to go through the process?
Yeah, look, I think like New Zealand, I think Australia actually handled the outbreak fairly well, I think pretty well. And I think one of the reasons for that was here in Australia we had quite a good working relationship with industry, with government and other experts and stakeholders and pharmacists. And I think, like some of the comments that were made before, I think here we had some extraordinary levels of cooperation between the different sectors that we probably haven't seen for a while here in Australia. And so I think going forward, looking at our long-term medicines policy, I think there'll be some lessons about and learnings from that, the way that different stakeholders could come together and manage things. I think that will be important because I think one of the lessons that's come out, not just in our countries, but internationally, is this concept, and this is starting to be debated internationally now, about preparedness and resilience of health systems. In some ways, COVID-19 wasn't a black swan moment. There's lots of reports you can find to sort of say there's a pandemic coming. There were lots of recommendations made that were never implemented at international level and weren't always followed or well resourced in health systems. And I think those health systems that have handled the pandemic well are the ones that have had good systems, have relied on evidence, scientific evidence, and have gone quickly to the evidence and acted on the facts and evidence. The ones that haven't been so prepared and perhaps haven't been quick enough to follow what the evidence is, I think they're the ones that have been struggling, frankly. And so I think it's going to be a lot of lessons, for New Zealand, Australia, and many countries around the world, and international agencies as well, about how we take our health systems forward, learning lessons from COVID.
Great, thank you, Brendan. So this is the final question. It's for all the panelists, but we'll start perhaps with Liz, if we can, which is what do you think is the most critical or pressing issue to get sorted in the design of a new medicines policy?
Oh, look, for me, that's quite easy. That I strongly believe we've got to break out of a siloed approach to enabling access to new medicines in New Zealand. And I think in the policy white paper for discussion is the concept of introducing medicines appropriation, which I believe would enable not just transparency of funding and investment in medicines, but also enable a whole of government perspective to the value of investing in medicines and enable New Zealand to access these new innovations that we're talking about and supporting new policy that hopefully will be put in place.
Chris, what's your view? What do you think would be the most pressing issue that needs to get sorted in the design of any new medicines policy?
When I look at the original policy, Graham, it feels a bit operational to me. So I think this is an opportunity to really lift it up and make sure that it is a strategic policy, that we're really bringing into play the big changes in science, and that we're being real clear against some of our objectives around equity and access. I think the whole thing, the point that Chris made too about making sure it's tightly integrated into the whole health system, which I think needs to be done. So bringing it in sync with the Health and Disability Services Review. But yeah, this is the big chance to be real quite strategic about it. And I think we need to do that and take a long view on this one.
Hey, Chris, you got anything to add? What's your views on?
Look, I really think that New Zealand as a country has to work out what it wants. And what are our priorities, really? And I don't get a sense that quite we're sure exactly what that is. I mean, are we looking for a policy which is going to deliver optimal health gains, or is it going to be a quick and cheap one, or quite what is it? You know, what are our settings? We hear a lot of comparisons about New Zealand, Australia, and the UK, for example. But the fundamental question is, do we want to be like them? Actually, many people in New Zealand, when it comes to cancer medicines, would say, well, yes, we do. We absolutely want to be more like them in terms of access to advanced disease medicines, whereas others would say we need a much bigger focus on early diagnosis and primary prevention, you know, and then what the balance is between those investments. I think that needs to be clear. How much of a player do we want New Zealand to be in terms of research and development, and in terms of investment in the R&D space as well? And do we just want to import knowledge overseas, or do we want to look to contribute to the global development of knowledge in this country to encourage our own scientists, our own medicinal chemists, our own clinical researchers, and ensure actually that trials are done and developed in New Zealand for the health sector as well? So some of those key questions, I think, need to be sorted out. What do we want to achieve? And then once we've sorted out what we want to achieve and what a good level of investment is, what a reasonable level of investment is, because I'm still not clear what that level of investment is. We know that New Zealand likes to keep its cost per quality down, but what is our investment levels? What should they be? And then starting from that place, and then working on from there. Very clearly in New Zealand, we have treaty obligations to our Indigenous people, which must at all costs be respected. And that means partnership. And true partnership means walking hand in hand with tangata whenua and ensuring that tangata whenua voices are heard, and that Māori needs articulated and met by any strategy as well. And that requires proper co-design and proper joined up leadership with Māori and our ministry. So I think there are some challenges there in terms of thinking about what we need out of it, the process for how we develop that in terms of partnership, not just with industry and researchers, but with our people, and then looking at what our markers of success are and how we will measure whether or not our policies have been successful in terms of delivering what it is that we've aimed to get. And if we get intent, design, process, and then we'll get outcome, and we can look back and see if that has been successful.
Brendan, from your perspective, I mean, you're obviously looking at your medicines policy update. So, I mean, what do you think the most pressing issue from the Australian perspective is for yours?
Oh, look, there's lots, but I think one of the things I think is ensuring that health systems in the future going forward have medicines and treatments. So let's say health technologies, medicines and treatments as a central part of their health system. I know it sounds obvious to say that, but I think making sure that's actually a part of the policy of your health policy, I think, is really important. So I think the COVID-19 outbreak is actually a classic example of what happens when you don't have access to therapies. I mean, we have a few treatments and vaccines for it at the moment. And there's sort of two aspects to that. I think one is actually that the medicines or treatments and vaccines actually exist. So at the moment, right now, COVID-19, there are no vaccines, there are no treatments that are approved for it. And so we need to make sure the medicines actually exist and the vaccines exist. And then the second part of that is once they actually exist, once they've been developed, once the technologies have been developed, once the science has worked and they've been commercialised, the second part is then making sure that people have access to them. And that's as difficult, if not more difficult, discussion almost about how to make that happen in the context of a health system that's fit for purpose for the 21st century. And so I think having a good strategic dialogue about that, about how the health system is and how medical technologies fit in as part of that, and how your health system can use those as part of a health system, I think is really important. That's certainly, sort of things I've been saying about Australia's medicines policy, and I think other countries like New Zealand, I think that's an important issue.
Right. Well, great. Well, thanks everyone. I think to me some of the big take-home messages there is collaboration is clearly quite critical in this, and it's about partnership as well. It cannot be done in silos individually, and hopefully by working together to figure out in partnership and collaboration what are we looking for. I think to echo Chris's point, it's quite critical. What are we trying to achieve is going to be quite critical in any medicines policy and future-proof medicine strategy. So look, on my thanks to all the panelists for today's engagement, and if anyone wants to sort of engage with the consultation process, if you have a look at the final slide that will be coming up after I've finished talking, and you can give us your 2 cents worth or $1 worth, please engage. It's a consultation, it's collaboration and action, and it's all online, which is what we're living with in this COVID-19 world, I guess. So my thanks to the panelists for all their time today, and take care. Ka kite anō.